Our next speaker is Dr. Nally from the USDA. His background is as a veterinary microbiologist with a specialism in spirochetes and leptospirosis. And the title of his talk is The Development of an Ovine Model of Digital Dermatitis Infection. Dr. Nally.
Thank you.
It should come up, I trust. Yeah.
Okay. Good morning, everyone. I would like to start by thanking Michael Doherty and the rest of the committee for all their efforts and for the opportunity to be able to speak with you today and tell you about some research we're doing to develop an ovine model of digital dermatitis. This research is a collaboration between ourselves, myself, Jennifer Wilson-Welder, and David Alt, based at the National Animal Disease Centre, and Professor Paul Plummer at the College of Veterinary Medicine at Iowa State University. So, digital dermatitis is a disease that causes lameness in ruminants. It's an infectious disease. There's no evidence for any viral or fungal agents involved in digital dermatitis, but we do know when we look at lesions very carefully, we see a large number of different bacterial species that are associated with infection. More specifically, we have identified spirochetes. This is a transmission electron micrograph of one of those spirochetes associated with a lesion from a case of digital dermatitis. And we see multiple different species, multiple phylotypes and morphotypes of species of pathogenic treponemes. And we know this through various different techniques, including high throughput deep sequencing techniques, metagenomics, through fluorescent in situ hybridization using very specific probes, and through culture. The difference is when we try and culture these treponemes, we're really limited in the number of treponemes we get back compared to the numbers that we know are present through the high sequencing techniques. And so typically when we culture one of three groups, those that belong to Treponema medium, Treponema vincentii-like organisms, Treponema phage-dennis, or the more recently described Treponema pedis. We see this disease in different ruminants. It was originally described by Chelly and Mortellero in 1974 in dairy cattle, and here we see classic M2 lesion, a very circumscribed, moist, ulcerative lesion. And we see quite different clinical presentation depending on the animal species. And so while we see this type of a lesion in cattle, when we look at sheep and contagious ovine digital dermatitis, we see a different kind of lesion. We see inflammation associated with the coronary band. We see progressive separation of the hoof capsule. CODD has been described since 1997 in the UK. We've identified it in Ireland. And I guess one of the other forms of digital dermatitis that we've been working on in recent years have been in elk from the state of Washington in North America. And in elk, it typically presents with a deformity of the hoof, as illustrated here. So in all these cases, they're all digital dermatitis, but they have very different gross presentation. If we look at the microscopic level, we see similar histopathology. And I guess for me as a microbiologist, the most important thing is that we see a very common bacterial etiology. And specifically, we see spirochetes associated with each of these lesions. And remember, this sample is from an elk in Washington. This sample is from a sheep in Ireland. And this case is from a cow in California. And in all cases, we see treponemes deeply invading the tissues. I just want to clarify today that I'm not here to talk about developing a model of contagious ovine digital dermatitis. As I say, I'm a microbiologist that's interested in the bacteria that cause this disease. I'm interested in developing a model where we can replicate the disease because of the presence of this pathogen and to try and understand how the pathogen is interacting with the host to cause the pathology. So some background information just to let you know some considerations that we were putting in place when we were developing this model. Some predisposing factors that are well described in the literature, the presence of a compromised foot, the exposure to consistently moist, unhygienic environment, and the classic example here is the dairy cow standing in a slurry all day. And I put down negative energy balance here, question mark, as a sort of catch-all phrase, because there's lots of evidence in the literature to indicate that a negative energy balance does act as a predisposing factor to infection, whether that's through inadequate access to sufficient energy in the form of the proper nutrition, through immunosuppression, parturition, etc. But again, as a microbiologist, my goal here is to try and develop a model using the specific etiological agents that we believe are associated with infection to try and reproduce the disease in a robust manner and ideally in a clinically relevant model. And that's why we turn to sheep. It's a lot easier to handle a mature sheep than it is a mature cow. So this slide just gives you an overview of the specifics of the model, and I will get into more detail throughout the presentation. We start at day -3. We scarify the tissue very mildly. We wrap the foot to maintain a wet, moist environment. We started our model using lesion material from cases of bovine digital dermatitis. We maintained that wrapped foot for several weeks. We maintained the moist environment by adding broth, culture media and ruminant fluids to maintain that moist environment, and we take off the wraps periodically to at least describe what lesions appear and how they appear and how severe they are. These sheep are maintained on dry bedding on a concrete paddock. They have a restricted diet to hay only. If the animals do suffer any lameness, we do treat with the necessary pain medication. This illustrates a little more detail. The very first stage is scarification. It's a very mild abrasion. This image was actually taken several minutes after we performed the abrasion, so you can see it's not too severe. It's certainly not very invasive. The idea is just to disrupt the surface skin layers. We then apply moist cotton. The moist cotton is wet with anaerobic broth fluid, some rumen fluid. We also place a padded cannula, and the idea there is to place the cannula so that we can come back, re-moisten the cotton periodically without actually upsetting the wrap. We apply a brown moist gauze. We cover that in a plastic wrap. We apply a vet wrap. You can see the cannula just appearing just above it. We cover that with an extra strength duct tape, and then we just apply a final layer of vet wrap just to hide the cannula to stop the sheep chewing on it. When it comes to day 0, time of infection, we will just open up the bottom of the foot. We'll apply the inoculum, the lesion homogenate, from a case of digital dermatitis. We'll reseal it, and then we'll examine on a weekly basis. Okay, so really the sheep are very happy, very comfortable, and I just want to give you a brief overview of results from 2 experiments that we recently performed. So the first experiment, we take a clinical lesion from a case of bovine digital dermatitis. We create a homogenate, and the homogenate is actually the inoculum that we use to start the infection. So in this case we have mock infected animals. They are just they are wrapped as per the procedures I just described, and we'll just give them a negative media for the inoculation. And in the case of 4 out of 4 hooves that we unwrapped after 2 weeks post exposure, you can see that the lesions, the scarification, the abrasions that we applied have all healed. We also looked at 8 hooves where we did the inoculation. 6 of the 8 you can see an erosive lesion. 2 of the 8, the lesions had, the abrasions had healed, and it was quite clear that any lesions that were present were in the process of healing. So 2 of the 8 we describe as healing, 6 of the 8 we describe as having an ulcerative lesion. All 8 were positive for the presence of spirochetes. The other point I would just like to highlight is you saw the image where we performed the lesion, the position of that. And where the actual ulcerative lesions appear, you can see it's not consistently at the same spot where we performed the abrasions, and that's consistent throughout all our observations. At 4 weeks post-infection, when we unwrapped 8 of the mock inoculated hooves, 7 of the 8 had healed. In the experimentally infected hooves, of 16, 14 had ulcerative lesions, 2 were described as healing. All 16 were positive for the presence of spirochetes. When I say they were positive for the presence of spirochetes, we take swabs, we look at the swabs directly by dark field microscopy or phase contrast microscopy, and as expected you can see that there are multiple different bacterial species present, whether that's from the mock inoculated or the inoculated. We'll take these swabs, enrich overnight in appropriate broths, and you can see very clearly that we do just see multiple spirochetes appear from those lesion swabs. We have performed histopathology. It's very clear that there is some inflammation, primarily neutrophils. We see ballooning keratinocytes, and when we do silver stain for the presence of spirochetes, you can see that multiple spirochetes are present, and it's quite invasive into the tissue. There is a serum antibody response, so this results just demonstrate that when we take serum from these experimentally infected sheep and perform an ELISA using a mixture of sonicates derived from the treponemes compared to the mock controls, whether at day 0 or the mock controls at week 4, there is a serum antibody response indicating that the host is recognizing the pathogen and reacting accordingly. We have done another experiment whereby we have used lesion material from these experimentally infected sheep. So rather than using the lesion material from infected cattle, we're using it from sheep. We want to be able to demonstrate that we can maintain this model and reproduce the disease accordingly. And these results show the results of some of that experimental protocol. 2 weeks post-infection, when we looked at 4 hooves, 2 had lesions, all 4 were positive for spirochetes. Similarly, at 4 weeks, 3 of the 4 hooves that we looked at, lesions are present, all 4 are positive for spirochetes. 6 weeks post-infection, 8 out of 8 hooves had lesions, 8 out of 8 were positive for the presence of spirochetes. We left them unwrapped. At 10 weeks post-infection then, 6 of those had resolved, 2 of the animals had still quite severe lesions, and that was associated with compacted material in the lesion. We have performed molecular techniques to validate what pathogenic treponemes are present, and you can see here at week 4 post-infection in those sheep that were inoculated with the bovine lesion homogenate, they're all positive for the presence of treponeme phage, treponeme medium, or treponeme pedis. We're in the process of evaluating those sheep samples, and at 4 we've looked at all 4 were positive for T phage, 2 are positive for T medium, and 2 for T pedis. So that's the summary of the model. We're using our homogenate to induce these lesions. There's pathology, there's a host immune response, and the spirochetes are certainly present very deeply in the tissue. So we're in the process of continuing to refine this model to address specific questions to understand the pathogenic mechanisms of infection in terms of disease persistence, recurrence, disease transmission. We're in the process of using this animal model to try and develop, optimize our diagnostics, optimize treatments. One of our real important goals we feel is to try and identify the synergistic roles of each of the bacteria that cause infection, as well as vaccine development. So I'll leave it there, and I'll be happy to try and take any questions.
Thank you, Dr. Nally. We have time for one quick question. The gentleman at the front. Again, if you could wait for the microphone.
Morning. Nice talk. Inevitably, what you're putting in is you're putting in a super bacteria from the cow's feet.
Yeah.
And obviously the spirochetes are playing a role. What role do you think other bacteria might be playing? And do you see other lesions which don't look quite like cod? Do you see anything that looks like foot rot or anything else like that?
No. So the lesions, just like I showed you, the images show you that sort of ulceroproliferative lesion, which is not like cod, but I believe it's a function of where we're applying the abrasion beforehand and where we're placing the inoculum. And the question with regard to other bacteria, whether they're playing a role or not, is exactly the type of question that we want to address as we continue to refine the model. Because these sheep, they're maintained in a very clean, a relatively clean environment. So you could hypothesize that as you maintain that infection from animal to animal over time, that you could as long as the pathology stayed there, you would lose those environmental contaminants that are present as opposed to those organisms that are present that are causing pathogenesis. It's a tough question, and I don't have a real answer, but that's exactly the type of study that we'd like to pursue using this animal model to do that.
Happy? I'm sure Dr. Nally will be around for the remainder of the morning. We have to
I'll see you
stick
later.
Absolutely.
rigidly to time. Thank you very much,
All right,
Dr.
thank
Nally.
you.